Hello, and welcome to the podcast supporting all of us through COVID-19. On this episode, we'll be talking about care for caregivers and school staff. My name is Dr. Christine Daigle, and with me is Dr. Marc Crundwell from the Greater Essex County District School Board Psychology Department.
Hello, everyone, and thanks for joining us today.
We're here with another podcast to help families through this really challenging time that we're all experiencing as a result of the coronavirus. Today, we're going to review some tips from the National Association of School Psychologists on how caregivers, as well as school staff, can take good care of themselves so they can also take good care of their children. The article we're using as a reference is linked on our website, but we want to use this time to discuss and highlight some of the ideas presented in the article.
Exactly. It's common for parents and teachers and other caregivers to often ignore their own needs when trying to help children cope with a crisis. Our first instinct is always to focus on the needs of our children or our teenagers, which places much more stress on us as the adults, increasing the stress that we already have.
Yes. We can put ourselves on the back burner, which isn't good for our well-being, and as a result, it's not good for the well-being of our children.
Definitely. It's really important for us caregivers to monitor our own reactions and take care of our own needs. If we ignore our needs, it can lead to high levels of stress and even burnout. So one of the things that I often think about when I'm flying is the demonstration that happens before you take off, and they tell you about that air mask. And it's very clear, they say that if there's that cabin depressurization, it's very important that we as adults put the mask on first, so then we'll be able to help our children or others be able to put their mask on. So I think that's a really good analogy that we need to take care of ourselves in order to then be able to take care of others. And this is especially true in crisis situations like the one we're going through now. Our normal support systems, like talking with friends and family, have been often severely disrupted, and we're out of our normal routine almost every single day.
Right. Burnout is a very real thing that can interfere with our ability to support others. It can lead to us feeling detached from others, where we can feel like we just can't find it within ourselves to care anymore. And in addition to burnout, we can experience something that's called secondary trauma. Secondary trauma is stress we feel when hearing about another person's story, another person's stressful experience. And it can also happen when we help somebody who's been affected by a tragedy.
Right, and it's important to realize that factors like our own past experiences of loss, grief, or a lack of a support system can make us more vulnerable to all kinds of stress as well. So for both parents and teachers, we need to be aware of our own limits, even though we want to help others.
Yeah. One important thing is for us as caregivers to monitor ourselves at a time like this. There are some signs that we can recognize that we may be experiencing, and we may start to show some aspects of burnout. One area is what we call the cognitive area, and we may see in ourselves the ability to just stop thinking about the situation. We may have more difficulties making decisions, and we may seem to have difficulties expressing ourselves. We also need to monitor our physical reactions. Those can be signs as well, such as feeling fatigued and exhausted, experiencing headaches, other pains, losing our appetite, and having increased difficulties with sleeping.
Yes, and we also need to check our own level of worry and anxiety. Do we feel more irritable? Are we getting angrier much quicker than we typically do? Or are we having more distressing thoughts than we usually have? Also, we should monitor whether we are drinking alcohol more than we usually do, or are we withdrawing from our family and friends so that we are not socially connected in the same way that we usually are. All of these are signs that we need to think about taking care of ourselves so we can be in a much better position then to take care of our children and teenagers.
Right. So the National Association of School Psychologists provides us with some suggestions to prevent burnout. First, Physical self-care is very important. Maintaining healthy eating habits, drinking plenty of water, limiting the use of substances such as alcohol, and getting plenty of sleep can help us start off in a good place.
While physical care is definitely the place to start, we also have to think about emotional self-care as just as important. We need to know our limits. When we're feeling anxious, when we're feeling upset, it's okay to take time out for ourselves. And you can be honest with your children about how you're feeling. For example, you can say things like, I'm upset right now, I need a break, I'll talk to you in a few minutes when I'm feeling better. Any way you feel about what is going on is okay. These reactions are normal feelings for caregivers to experience.
That's right. And to help with some of those feelings, it's essential to maintain social connections. Set up a normal daily routine, connect with friends and family over technology or the phone. Stay in touch virtually with your community support, such as your schools, or if you have places of faith. It's important to have someone with whom you can process how your day went.
Yes, we can't stress enough how absolutely important it is for you to keep up social connections. But it's also important to acknowledge that you and your family may also need additional help. So you can access community crisis support or talk to your doctor, a psychologist, or a social worker, or other people who are licensed mental health professionals. What's really important is not to think you need to deal with this all by yourself. Know that it's okay and important to be willing to accept additional help, and that it's a very positive thing and it is not a negative thing at all.
Definitely. This is especially important if you're experiencing symptoms such as an inability to stop thinking about the crisis, an inability to make decisions, if you're feeling chronic fatigue, exhaustion, headaches, loss of appetite, or difficulty sleeping. Other signs you should talk to a professional about include excessive worry, anxiety, feeling numb inside, irritability, anger or rage, distressing thoughts or dreams, withdrawing from your friends and family, substance abuse, severe depression, and suicidal thoughts. Reaching out to healthcare professionals when we're in distress is critical.
It definitely is. So I would like to again invite you to please visit our website at publicboard.ca to read the full article.
And just to sum up, this is a difficult time for us all. Just keep doing the best you can. Be kind to yourself, be kind to your kids, and thank you for listening.